Pleasant day, dear viewer. We are glad to have you here and to know that you are interested in the different drug interactions that can occur to anyone. In this video, we will talk about few of these interactions and learn their effects and possible ways to prevent them. First, let us get to know these two friends that will help us understand how competitive displacement in drug interaction occurs. First, greet our friend with aspirin. Aspirin will help us whenever we feel mild pain or when we have fever, while methotrexate is under the class of antimetabolites that can be used for cancer treatment, psoriasis, and even rheumatoid arthritis. We saw that even though these two medications can be taken orally, they have completely different uses. So, what will happen if these two medications can enter the body at the same time? A pharmacokinetic interaction under distribution occurs, specifically displacement. What is displacement? Displacement is generally defined as the change in position of an object, like this key and lock. Removing the key from the lock is an act of displacement of the key which directly affects the use of the lock. This concept can be applied in medications as well. When a drug is displaced, its effects will change. Drugs need to be attached to these tiny molecules, which can be enzymes, nucleic acids, or specialized membrane-bound proteins, in order to exert their effects called the receptors. These drugs are made for a specific receptor in order to have beneficial effects, and this is where displacement in drugs could occur. Say that our friend methotrexate enters the body, it automatically binds to the receptors it is meant to bind to and thus giving its effects. However, the moment aspirin enters the body, they immediately fight for the same receptor. But since aspirin naturally has a much stronger bond to that receptor compared to methotrexate, methotrexate has no choice but to admit defeat and let go of the receptors, while aspirin binds to it swiftly. Now, what will happen if methotrexate enjoys its ride in the bloodstream too much? If methotrexate stays in the bloodstream too much, then the result will be an increased blood concentration of methotrexate, and at the same time, there will also be a reduced elimination of methotrexate that may lead to toxicity, especially if high doses of methotrexate are being displaced. This, our dear viewers, can put our bodies at risk. So with this, are you familiar with the common signs and symptoms of methotrexate toxicity? Some of these are mouth ulcers, sore throat, anemia, or low healthy red blood cells, bleeding or even nausea, vomiting, and diarrhea. Now that we have explored what's going on in our body when methotrexate is taken together with aspirin, let us now talk about the possible treatment and management needed to prevent the unwanted effects between the two medications. But before that, be reminded that treatment may vary depending on the condition of the patient. These interventions include: first is close monitoring, second, dosage adjustment, and third, alternative medication. Close monitoring involves regular monitoring of laboratory results like blood tests and as well as any physical manifestations, while dosage adjustment is performed when there is a need to either increase or decrease the concentration of a drug. Usually, these two interventions are done when there is a great need to take methotrexate and aspirin, but with proper caution and as directed by the patient's physician. However, in some cases, when a patient is at high risk of experiencing adverse reactions brought by the two medications, or if pre-existing renal condition is present, an alternative medication is provided. For example, using other drugs that have the same effect of pain relief with aspirin, such as paracetamol. To sum up, drug information is important, especially when taking two or more medications. Thus, it is vital to discuss medications with your healthcare provider before taking them to prevent undesired drug interactions that may arise, just like in the case of methotrexate and aspirin. Thank you for listening.